medical advisor to the White House, is now saying that a rise in COVID-19 cases is unlikely to cause a significant surge or trigger widespread restrictions. Here to answer your questions about that and a lot more is Dr. Robin Colgrove, an infectious disease specialist at Mount Auburn Hospital. Great to see you, doctor. Thanks for being with us.
Always a pleasure.
Yeah, good to see you. You know, federal health officials expect to see an uptick in infections from this new COVID subvariant, the BA2, right? But Dr. Anthony Fauci doesn't sound too concerned about it yet. What about you?
Well, Dr. Fauci is a very smart guy, but I would stay out of the business of making firm predictions about this pandemic, which has thrown us one curveball after another. I would say more likely than not, this is not going to be more severe. And with the immunity from vaccines and from pre-existing infection, probably this won't cause a big uptick in cases, but there's still a lot of uncertainties here.
We'll take more likely than not, doctor. So there are two new studies out there suggesting that Omicron survives longer on surfaces than other variants. We know that the primary transmission for COVID is not surfaces, but is that one reason why it may be spreading faster than Delta, why Omicron might be spreading faster than Delta?
It's possible, but somewhat less likely. I think it's important to emphasize here that this paper, I saw this preprint, is a preprint. This is not a peer-reviewed article, and it's written by people who are not really mostly virologists. And as a virologist myself, I would quibble a little bit. Viruses aren't alive in the same sense that a cell is, so survival may not be the right word. But I think it's fair to say that, that their data would suggest that the BA2 variant persists in an infectious state for longer on surfaces. I mean, it's actually been a feature of the COVID pandemic since the start, how little transmission of infection we see from surfaces.
Right.
It's too early to see whether that will happen in BA2, but it hasn't been a major factor so far.
I just need to interrupt really quickly. So when we talk about surfaces, is it that someone who is infected with COVID sneezes and that's how it gets on the surfaces? I just want to make that really clear to everybody.
I mean, that's a supposition, and that is an important mode of transmission for, say, rhinoviruses, which cause colds, adenoviruses, other viruses. It has not been an important mode of transmission so far for SARS-CoV-2.
Let me ask you this, too, because we know that so many people, because it spread so rapidly with the original Omicron variant there during the first surge, is there a chance that they could get reinfected with this second strain, the BA2?
Well, there's a chance, but it's less. So one of the striking features of the Omicron wave is how many reinfections we saw, how many people who had had COVID before who got it. And that seemed to be the real game changer for the Omicron, its ability to evade previous immunity. That doesn't seem to be true so far for BA2 relative to BA1. The immunity conveyed by BA1 infection seems to be pretty good, at least in vitro, which is all we know so far compared to BA2. So we think although infection is possible, it's less likely than with the last wave.
And so interesting to hear what you have to say. You can quibble all you want. That's your role. You're the expert. Dr. Colgrove, thank you so much for your time today. We appreciate it. Thank you. Stay well.
My pleasure.